can't believe I can't believe. Well, Mark, it looks like we got prom masters here too.
Oh, God.
I know that's that.
Oh, we're doing that.
Okay, let's do it. This meeting of the Board of Education is now called to order. Please rise and join with us in the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I want to welcome everybody to our August meeting and remind everyone if they would like to speak tonight to please sign the registration form. Our Community Relations Manager, Michelle Karpinski, has that. Our first order of business tonight is to approve our agenda. Are there any changes to the agenda as presented?
None for me.
Okay, can we have a motion to approve, please?
Yes, Mr. President, I'd like to make the motion that we approve the agenda as printed.
Thank you.
I second.
Thank you. All in favor, please say aye.
Aye.
Opposed? The motion passes and we'll move forward with our agenda as printed and go to our superintendent's report. Mark?
Thank you, Randy. We have 4 items scheduled for reports today. The first 2 are the bond project update and the bond budget update, and Mr. Herron will do that presentation. Wherever, there he is. He'll be joining us at the table.
Good evening, board members. Would like to quickly just give you a short synopsis of what activities we have going on the bond projects. Some may have noticed that we're putting up the new wayfinding sign on Central Campus. I want to thank all those who called us today with the signs being kind of in disarray today. Those signs are just, were set there, being prepared for tomorrow to be set. So those signs won't look the way they look today, just for those who are interested. Other activities are continuing to do some commissioning in the auditorium here at the North Campus, and also have some, we're investigating our drainage field, continuing to check into what we can do to make sure that that is draining appropriately as designed. So those are the activities that are going on as it relates to bond projects. The next portion that I have for you is, I wanted to give you while I was here, kind of a summary of where we are with our enhancement projects. You have before you a memo and a list of future enhancements. As I state in the memo, these projects are being considered currently by the district. There are several that are highlighted in your document, and they will be, those are items that we are currently investigating and going out and getting bids and cost estimates for the board. The remainder of that list are additional projects that were identified by the bond steering committee along with our operations group, and we'll be coming to you in the future with information about those projects. So you have those that we are currently looking at too, and those that we will be looking into in the future. As I state in the memo, we'll continue to come to the board for unallocated contingency funds for those projects. As we deplete those funds, in the future. We will, again, we have a couple of options in the future as those become depleted, using both building and site sinking fund dollars and unallocated contingency. As those are depleted, we can utilize more building and site sinking funds. So that's a strategy that Mr. Edwards will be working on in the future and working with the board on. Again, two of those items we are bringing are on the agenda tonight, and that is the softball dugouts and some technology items, which will be later on the agenda and be asking for approval on. So if you have any questions, let me know.
Hey, Ron?
Yes.
I mean, the unallocated contingency, it looks like on the thing is 1.9 million right now. And the 705,000 that we've already approved, is that out of that 1.9, so we're at 1.2, or is that?
No, it's actually from your reconciliation change order, which was number 36.
Okay.
We had 2.6, I believe, at that time, and that 700 is out of there. So the 19 is exactly where we're at.
1.9, but
Yep.
the softball's not out of that because we haven't
Correct.
approved that, right?
Because you haven't approved it yet.
Okay, so the 1.9 is current as of right now?
Current as of now.
Okay, thank you.
Any other questions? All right, also you have change order 39, which there were no change orders affecting your financial update, as Kurt just indicated. We currently have 1.905779 left in that unallocated contingency pot for the board to decide on how to utilize in the future. That's all I have for you.
Thanks, Ron.
Yep.
Appreciate that.
Ron, are you leaving? Yes. Oh, well, before Ron leaves, for those of you who don't know, this is Ron's last meeting with us. Ron is retiring at the end of August, and Ron is the one who's led all our bond construction projects from the 2015 bond. And we owe a debt of gratitude to Ron for the good work that he's done to bring all those facilities online, on time, and under budget. And Ron, again, thank you. Ron will say this is his fourth retirement party, but anyway, we can't thank him enough, and we appreciate your service, Ron, and good luck in your retirement. Thank you.
So our next report is an update on the district wireless.
Replace the wireless systems at Central Middle School and North Middle School to address connectivity issues we've had there. We've ordered all of the gear. The wireless controllers are in, but unfortunately the access points are now on back order through mid to late October. IT supply chain issues continue to be very unpredictable. We had a long conversation about perhaps putting our old wireless system back in those buildings to try that. But after an engineering review, it became clear that would make matters more than likely worse. I had a conversation with the leadership from both of the buildings, and it was their decision to stick with the existing system until all the replacement parts come in. We're going to do everything we can to support the teachers. Fortunately, with all of our kids back in the building, some of the demands for the online components will be less this year than they were during our school year last year. I also wanted to let you know that our technology audit has been complete. I don't have the final report yet, but the overview is very positive. The auditor went through all of our central systems and then took some buildings at random to review data closets and connectivity, things of that sort. Gave us a green light across the board. Had about 24 little tweaks we can do just from a security standpoint, but nothing related to performance or overall network integrity. This engineer also gave one more look at the wireless systems at Central Middle School and North Middle School, confirmed that everything is set up and it should be working fine, but his concern, which is the concern that's been raised by everyone who's looked at those systems, the amount of radio interference in those buildings is a problem. I'm continuing to try to find a surveyor to come in and do an RF study of those buildings, but I'm having a hard time securing someone just because of all of the shortages that we're dealing with right now. But with that update, I take any questions the board might have. Thank you.
Thanks, Dan. Thanks to your team, too, for all the work they did this summer getting ready for school to open up. And then our final report is an update on our opening plans for this fall. So our curriculum team is here to do that presentation. Dr. Pasco?
Yep. Good evening, Superintendent Belang and trustees. Tonight we'll provide an updated overview of our COVID response plan as it relates to protocols and mask wearing. As we all know, we're in an ever-changing environment. It's fluid, in which we've been accustomed to responding and adjusting to, and keeping to the heart of our return to learn plan from last year being safe, flexible, and fair. We want to keep those as values as we move into the 21-22 school year. So tonight we'll be sharing the following updates throughout the presentation. We'll look at some projected enrollment numbers as of today. We'll look at the current county health status. We'll talk about our layered mitigation strategies, specifically mask wearing. We'll look at our contact tracing and our quarantine process, as those are the areas in which the guidance continues to be fluid and ever-changing as we get closer to the start of school. So let's start off with enrollment. So looking at enrollment as of today, both virtual and our total face-to-face. Currently, we're planning for 116 students virtually at elementary. We're now at 44 at the middle school level, and we have 71 fully virtual high school students. Again, just to reinforce the last presentation, at the elementary virtual program, we have 6 teachers allotted. They'll be located at Lake Center. Those classrooms are being prepped as we speak, so they'll have a conducive teaching and learning environment. The 6 FTE also includes a special education teacher within that program, and we also have 7 FTE allotted to the secondary program, both middle and high school, for virtual programming. So overall, in our projected fall enrollment, we're seeing a potential increase of just over 200 students from last year. So we'll be close to around 8803 district-wide. That's our most likely scenario. Just to bring us back a little bit, fall of 2019, we had an enrollment count of 8892. So to put things in perspective, we're trending in the right direction, and we're close to about 90 students from recovering the pandemic student loss that we experienced. It was close to 300 students going into the 2021 school year. So that's a positive. I now want to hand it over to Mr. Huber, talk a little bit about the health status in our county. Mike?
Thank you, Dr. Pasco. Locally, our community transmission rate is now 165.5 new cases weekly per 100,000 persons. On the right-hand side of this, I know you have some detailed numbers in your packet. You can see the total number of new cases, which really matches the trend of the weekly cases. That's scaling so that both MDHHS and the CDC, we can match up with their rating levels. We also know that our vaccination coverage rate for students in our area is going to somewhere be between 43 and 50%. And I give you guys, you folks, kind of a range of numbers just because we aren't really sure if there are students or in neighboring areas. So we haven't been able to completely identify that, but we can get enough information for a good range of vaccinations. But all of these indicators currently have us at a high risk of transmission according to both CDC and MDHHS, which, as you can see, that's moved almost all of the indicators we were looking at into our red zone. Obviously, this is going to impact our protocols and mitigation strategies for the start of the school year so that we can ensure and maximize in-person instruction. As always, we continue to monitor our local transmission, and we adjust our guidelines, protocols, and strategies as needed based on that data. And Mr. Belang and also Mr. Galen stay in touch weekly with County Health Department staff and KRESA COVID response groups.
Go the other way, Mike. All right. So we are complying with the K-6 mask mandate set forth by the Kalamazoo County Health Department, as you see on the slide, provides a little more detail as to what was set forth. Curious Kids pre-K and Young Fives programs, they all take place in our elementary schools, so those students and staff are included in the mandate from our perspective. At the middle schools, the definition of persons in educational setting includes older students who are present in the same building. That's the case with us. We have 6th, 7th, and 8th graders in all of our middle schools. So this definition extends the mandate to our 7th and 8th graders so that we comply with the K through 6 mandate, and that includes all middle school staff. The mask mandate applies to all indoor activities. The county's order will remain in effect until at least 6 weeks after the COVID-19 vaccine is authorized for 5 to 11-year-olds, in which we will follow. Last week, we sent out our plan for mask wearing to both our staff and our families. Take a look at the high school. We worked closely with our high school administrators, develop a plan to help us reduce the number of quarantines at the start of the school year, and give us the best opportunity to provide in-person instruction for as long as we can. At the high school level, staff and students will wear masks within our classrooms. When staff and students are outside of the building, for example, PE and band practice, as we put in the communication, we'll continue to recommend social distancing, encourage the use of hand sanitizers. So passing time will allow students to get a mask break. We're still recommending students wear them in the hallways, but we'll allow our students and put trust in our student body to make student population to make decisions based off of what they feel is best, particularly when they need the breaks. We'll pay close attention to contact tracing and situations as we go to determine the effectiveness of this approach. So we sit here today being mindful that the numbers that are going to be walking through our secondary buildings are completely different than what we experienced in 2021. So we're mindful of that. So we'll have to pay close attention to the quarantine process, to contact tracing, and to see how this approach in terms of its effectiveness is going to be. You know, we'll continue to review that week in, week out, day in and day out. We revised our approach to our administrative guideline as it pertains to attendance, as well as our off-campus or outside the building protocols. This is in an effort to spread students out during lunchtimes. Again, lunchtime will be another opportunity for mask breaks, and students will have designated areas around the high school campuses so we can kind of alleviate that pressure that we feel with so many kids accessing the cafeteria. So that's the plan K through 8 and 9 through 12. So at this point, I'll pass it over to Mrs. Jensinius. She's going to talk a little bit about where we're landing with contact tracing and our quarantine process.
Thank you. Great, so thank you, Dr. Pasco. Our goal is to make sure in-person learning can resume safely as much as possible this fall. We know that not everyone is vaccinated or can be vaccinated, and therefore we're layering these mitigation strategies with the masking. As I presented early on in, I think, August, we talked about trying to maintain that 3-foot distance between students when possible, knowing our numbers where they're at. With the number of students we have. Classrooms had air purifiers that we purchased.
We'll have order, sir.
Thank you. Hand washing and good personal hygiene will continue to encourage that. And we know that with the touching of surfaces and whatnot, we will continue to clean once per day or as needed in our classrooms in different environments. Alongside that, our students, teachers, and staff should, of course, stay home when they have signs of any infectious illness and be referred to their healthcare providers for testing and care. Our visitors and volunteers will be allowed in the office area, and they will need to follow our current safety guidelines set forth. Transportation, as we talked about earlier, are required to masking due to our order, CDC order on all public transportation. And finally, the Kalamazoo County Health and Community Services Department is supportive of our overall approach, and we continue to work alongside them to make sure that as we need to make changes to our strategies with updated information and guidance that we do so together. Looking at contact tracing and quarantining, as of 8/20 of 21 this year, this is the guidance that we have, and this is just where we're at right now. We know going into this year, it is going to be a lot trickier based on the different aspects. So vaccinated and exposed, if you're a vaccinated person and you're exposed to a positive case, we know that you will no longer need to require to quarantine. You can skip that quarantine as long as you have received all the required vaccine doses, and of course following the 2 weeks period after or before the exposure. You're asymptomatic since that exposure. And the guidance also recommends that if you are fully vaccinated, it is good to get tested 3 to 5 days after that. And however, people who were previously diagnosed with COVID-19 within the last 3 months do not need to quarantine after that exposure occurs, but they still should isolate and get tested if they do have symptoms that emerge from there. If you are unvaccinated and exposed to positive cases, this is where there's a lot of information here around close contacts for students in a classroom setting means being within 3 feet of someone who is COVID positive for a total of 15 minutes or more over that 24-hour period. It also means engaging in sports activities with unfavorable frequent physical contact for a total time of 15 minutes with someone who is identified as positive. It can also mean within 3 to 6 feet of a positive case, and the exposed case student, K through 6 student was not engaged in consistent and correct well-fitting mask, or if they are older and they are unvaccinated. If in contact with a student with COVID-like symptoms and within 3 to 6 feet for a total of 15 minutes or over a 24-hour period, families we will be contacting for monitoring purposes. We do want to make sure that we're able to do that. If we go into a quarantine, we know that if there are students who are a part of a known outbreak or exposure, they're a close contact to a person with COVID-19, they should stay home for 10 days unless they, after 5 days, they can prove a negative test. So we could have a negative test and have them come back within that 5 days, which is different than in the past. And that does make sure that we work through that part. It's make sure that if you are in quarantine, of course, those same rules apply of being 10 days since your last symptoms, 24 hours with the fever, following still those same protocols that we did in the past. If you are positive and you have no symptoms, of course, then you isolate for the 10 days from the day you had your COVID test done. We are working to keep our students and staff safe and in the learning environment as much as we possibly can. We know we want our kids in school, we want them learning, we want them with us. We also know this information continues to change, and it's important to work with our students and their families when they test positive or are quarantined due to an exposure. And we know there are a variety of situations that are coming at us this year, and we want to make sure we address each one of those as individual occurrences so that we can take care of our families the best we can with what we know at this point in time. All this information is a lot. We do have it on our website and available for our families to take a look at. Dr. Pascal?
Yeah, I think that's it for tonight's presentation, but I do want to thank the board for working alongside us since the beginning of the pandemic. It's much appreciated. And so at this time, we'll open it up for any questions that you may have.
Dr. Pasco, could you please explain the difference in the attendance rules from the state this year versus last year?
The attendance rules?
Yeah.
We're basically going back to the pre-COVID rules for this year in terms of the way we track attendance, the way we report it, the way we're tracking the attendance through the front office. Basically, all the old regulations and protocols and guidelines that were in place prior to COVID are kind of back in place. So there's really that leniency that we had for 2021 is no longer. So there's more compliance coming into this year, and basically it's how we operate it, prior to the 2021 school year.
Could you explain what that means for a student that's absent?
Yeah, if we're talking
In terms of work and,
So going back to what we had talked about in terms of the changes in our attendance policy for our administrative guideline, what we realized was the old format that we had in our handbook and in the administrative guideline, it was actually penalizing students for missing school for medical reasons and whatnot. And one thing we obviously learned through the pandemic is when students are sick or ill, we want them to stay home. So we don't want something going against that. Kids would try to come into school to not get the 10th absence rule. That's something that we've removed in the administrative guideline. We moved that to a hard 15th absent rule now, where if a student gets 15 absences, if they're failing the course, they have to get 59.5 on the final exam to obtain the credit. If a student has 15 absences, they get to that number and they have a passing grade, they still need to get 59.5 at least on the final exam to obtain the grade that they've earned. So that's a big change. And also just the way that we're recording some of the absences. I don't want to say we're more lenient in terms of how we're looking at the medical piece, but we're obviously being more considerable in terms of when families are calling in and letting us know what's happening with their children. We want to encourage kids to stay home if they're not feeling well, and we don't want our own policies or our own guidelines preventing them from doing that. And I think that old 10th absence rule within the pandemic, again, our changes that we proposed to Superintendent Beeline were during the pandemic, and once we're out, hopefully we will be able to reassess and see what makes sense for anything in terms of a changing time and changing environment. But right now, I feel like we've made the necessary changes to be a little bit more fair to our families and our students, working alongside our high school administrators.
Thank you.
Hey, so Mike, what do we do with the kids who are quarantined, they're home, they're feeling fine, and last year they could jump on a virtual?
Yeah.
And this year, we won't have as much going on there. So
Yeah.
can you talk about that?
Well, we have to work, and this is conversations we're having currently, is we need to put some criteria and parameters around when would, say, a high flex situation come into it. I know our families have become accustomed to when a student's absent, they can high flex in, and to be honest with you, it's probably the most beneficial way or most effective way to receive teaching and learning versus something, well, when you're absent physically, versus just stuff that's dropped into Google Classroom. And we know that, and our families have been accustomed to that. So we need to make a decision as to what the parameters would be in terms of when that would be activated and how many, is it the reasons why students are out? Is it just the number of absences? We still have to work that out with our leaders and our teacher leaders out there as well. We're going to need some input and feedback as to what makes sense for both families as well as our teachers.
You know, part of this I'm hearing is be flexible. This is going to be another year of,
Continue.
there are
We
gonna
got to
be
continue
changes
to
throughout the
be
year.
ready. Yeah.
Yeah.
There's also, with that, Bo, there's the leniency, I think the flexibility that we had last year to be able to count that as instructional hours is not here this year. So I think that's what you were referring to as some of those rules are reverting back to what they were the year before. So we don't have that same level of flexibility in being able to count those students as being present in that mode. So we're still waiting on word from I'm not sure if it's the Department of Ed or the legislature to make changes to that.
Okay. Thank you.
Thank you very much. Appreciate that. I want to add just one last thing, not related to this, but we are, I don't know if you may have seen this, we are waiving the pay to participate fees this year for our students and families. We're in a position where we felt we could do that this year. And, our families have gone through a lot last year, and this is one way that we're trying to help out. So those announcements are going out today, and will continue to go out through our athletic directors.
That's good news, thanks.
Yeah, it's good.
That's great. Okay, we'll move to our comments and communications section, and first is comments from citizens. And Celeste, could you please read our guidelines for public comment, please?
I'd be glad to. The board welcomes community input at our public meetings. When addressing the board, please conform to these guidelines as follows. Sign the speaker registration form at the beginning of the meeting. State your name and address. Limit your comments to 3 minutes. Provide a written copy of your comments and supporting documentation to the board secretary if available. Present your comments in a respectful and professional manner. Refrain from mentioning any student by name and contact the superintendent directly regarding personnel matters. Board of Education members are not obligated to respond to issues raised during public comment. Normally, such issues are referred to the superintendent for follow-up.
Thanks, Celeste. We have a lot of folks signed up to speak this evening. We're going to have to enforce our 3-minute rule, so at the end of 3 minutes, I'm going to have to ask you to please end your comments. Our first public comment session, we're going to limit to 30 minutes, and then we're going to go back and complete our agenda, and you're welcome to stay, and we'll make sure everybody is heard at the end of the meeting. And with that, I'll invite our first speaker. Jen Gaylor, please.
Hi, my name's Jennifer. I live in the district. My information is on the sign-in sheet that you have in front of you. So we're talking about this again, right, everybody? Okay. I represent 2 groups in the community, Informed Citizens of Portage with roughly 470 members, Kalamazoo County Citizens United with more than 1,300 members in our group. The opposing group represents about 318 members. So Parents for Choice clearly outweigh the parents for mandates in our community. The opposing side, they're pretty vicious. They use our site they use their site to disparage us and you guys constantly. You have a public school teacher calling us Trump-tards and losers, another one calling us baby killers. One person went as far to suggest that kids not wearing masks is considered to fall under child abuse and neglect. These are the people that you're listening to. The CDC estimates roughly 335 children have died with a COVID-19 diagnosis in their chart out of 48 million children. 1,100 children, 15 to 19, committed suicide last year. Think about that, 1,100 teens. There are roughly 4,000 fatal unintentional drownings every year, but we're hyper-focused on 335, and while that is tragic, let's have some perspective. So I'm just curious, we're in the red zone, according to Mr. Hubler, but no one on this stage is wearing a mask right now, so. In 2019, the pandemic of H1N1, 358 children died from influenza that season. 2017 to 18, 643. 18 to 19, 434. All way more than the pandemic for 18 months now. Currently in our area in Bronson, there are 0 pediatric admissions to the hospital from COVID. 0. I came across a recent CDC study, and in that study it says, I quote, "Mask use among students was not statistically significant compared with schools where mask use was optional." In April of this year, the NIH listed a study on their website, and this group over here is going to say that it was debunked. It's a totally different article. All of you have a 50-page study copy in front of you there that you can peruse at your leisure. So I will read verbatim from the study, which was not debunked. Masks in everyday use pose a risk of contamination. On and in the masks, there are quite serious, potentially disease-causing bacteria such as fungi, E. coli, staph, and other bacteria. The masks filter large aerosol droplets, but cannot retain viruses themselves, and hence cannot stop spread of virus. This is not me, this is the NIH. The WHO has said, given the limited evidence, the benefits of mask use in children must be weighed against the potential harms. So,
Jan, thank you.
I
Thank you
ask
for
you
your
this,
comments.
is the board masking our, please, I have one sentence and I will wrap it up and respect your 3 minutes. I
you.
just ask you this, is the board masking children for the children's own welfare, or are you masking children to cover your own liability?
The more you clap, the more time we waste. So let's get to our next speaker. Welcome, Mr. James Asher.
With all due respect, I believe they can clap if they want. They've waited 2 years to get here.
I just want to make sure we hear your comments, sir. Please, go ahead.
I've been involved in politics for quite some time now, and I've been trying to crack the code on how do you get people involved. Well, you guys have done it. You guys have messed with America's mama bears. Now, I do want to thank you, board members, for allowing this time for both sides to speak. I want to begin by recognizing that the decisions you have made and those that are yet to come have not been easy. And I understand that the position in which you find yourselves is not one necessarily that you thought about when you might have ran. With that being said, yes, I'm a student here at Portage Northern. I'm proud to be representing my class as their student senator, and like I said, I go to here at Portage Northern. Will we be forced to wear masks, or will we allow parents to choose what's best for their families? The fear-based closures of the past 2 school years have resulted in lost educational time, and the number of students who have fallen behind is very unfortunate and will produce ongoing consequences. But the discussion on requiring masks in schools, the fact is we all know that children are not at high risk of becoming infected, not at increased risk for transmitting the virus to others, namely teachers, and not at risk for any severe health issues. Yet, these facts are not in dispute, and what's more is now there is a vaccine that is readily available for those who determine it necessary. The Michigan Department of Health and Human Services has not mandated masks, and they have left it up to school boards and local decisions, but to also take input from parents and students, so here we are. I want to make the point that I understand that the parents on the other side of this issue are not our enemies. However, I have to respectfully disagree with them. I recognize that a group of people are genuinely concerned for their family's well-being. I sympathize with them. I genuinely do. But while I do not know what it's like to be a parent, I do know what it's like to be a student that was masked up and how it actually does affect our learning. Now, I want to follow science. In August 2020, 56 of 115 North Carolina school districts left masking optional, and they did a study to see how that would affect the transmission of this virus. Superintendents reported primary and secondary cases by school and week of the quarter. The collaborative was developed by faculty at Duke University and the University of North Carolina at Chapel Hill. Of the 56 districts participating in this collaborative, 35 offered in-person learning and teaching for at least some of the 9 weeks, while 21 had in-person instruction only. Out of 90,000 students, only 400 had community-acquired infections with SARS-CoV-2, and there was no student-to-staff transmissions. I know my time is up, but I asked for at least 1 more minute.
No, sir. Thank you.
Teachers and parents in many high schools
Sir.
stores have been vaccinated as we waited forever
Sir.
to become available in the hope.
He's taking the
Sir, your 3 minutes is up.
He's into
We
somebody
have a
else.
motion for recess, please.
You know,
Mr. President, move to recess.
Randy,
Can we have a second?
he's speaking into somebody else's time. So
Please, what?
he's speaking during someone else's time. The clock is still running 3 minutes.
Well, we have a motion on the floor for recess.
I can't hear you.
We have a motion on the floor for recess. Is there a second, please?
Say that again.
We have a motion on the floor for recess. Can we have a second, please?
Second.
Thank you. All in favor?
Aye.
All in favor of taking a 10-minute recess? Please
Aye.
say aye.
Aye.
Aye. Recess for 10 minutes.